If you're a woman that is dealing with some uncomfortable or even painful symptoms down in the pelvic region, well, today I'm going to talk you through why pelvic floor therapy might be the best option for you. And if you're a woman that is not quite sure where to turn, well, I'm going to talk you through some of the most common signs and symptoms of the women that do benefit from having pelvic floor physical therapy. In this way, you can help reclaim your confidence in your body and feel like yourself again, because there are so many women dealing with issues that they find frustrating or embarrassing. But if there's someone to help you, wouldn't you want to know? My name is Dr. Dawn Andalone. I am a pelvic floor specialist, a physical therapist that works with women, especially women that are dealing with symptoms of bladder, incontinence, prolapse, pain during intercourse, or back or hip pain. A lot of times, these symptoms, you may go see your doctor and you're given an option for a surgery or for medication. But if you can control and work on the muscles around this area and around your pelvis and your core, then wouldn't you want a more holistic option and something that can be very beneficial to teach you a routine of things to follow and what could be triggering your symptoms when it's related to the muscles? So here is the pelvic floor, those muscles in red. If you've seen any of my other videos, I talk you through what those muscles actually do for your body, but they provide support for your bladder, your uterus, your rectum. They also control sexual function, and they are the support. So when you're in weight bearing and you're moving around, the pelvis needs muscles at the bottom here to support your hips and your pelvis and your spine. So that's the pelvic floor. It's like a basket of muscles. Well, if they aren't functioning properly, many women just think, oh, it's because I had kids or I went through the surgery. Well, we've seen women who have never been pregnant before, and they also may have some symptoms there. So it's not just for women during pregnancy or postpartum. During the menopausal stage too, your hormones are shifting, and this can affect your muscle tissue as well. So if you're age 40 and beyond, you may notice that you have some new problems you didn't have before, like bladder incontinence, having accidents or leaking, or when you're sneezing or coughing, you are leaking, or having constipation, painful intercourse, anything that seems new that you didn't have before. This is something that pelvic floor therapists work with. So like I mentioned, these muscles are for core stability. They're for bladder and bowel function and sexual function. Very important to make sure they're optimally functioning in the best way as you're aging. So how do you know if a pelvic floor therapist can help you? Well, if you've gone to the doctor, you've been screened for any major issues with your medical practitioner, but you're still having this problem. Maybe you're having constipation, you're having painful urination, you're having those bladder accidents, or you're having pain with being intimate with your partner, or back or pelvic or hip pain. Any of those symptoms can be solved by seeing a pelvic floor therapist if they are going to take you through how to get those muscles functioning properly, give you some exercises to do, provide more of an education about what's going on with your body and what might be triggering it throughout your day. So it's really important to see someone that's going to talk to you about your daily habits, what your history is like, and also what your goals are, especially for your daily activities and also your exercise goals. Another common thing that we help with is prolapse. So if you're not quite sure what that is, you may feel a pressure, heaviness in the vaginal area, and those pelvic organs are putting more stress and pressure on the vaginal wall, and therefore it can be uncomfortable, or you can even see something protruding there through your pelvic area. It can be often very scary to women, but it is not the end of the world. There are ways that we can help ease your symptoms, and there's countless times that I've worked with women who were told they need a surgery for prolapse, but they actually never did pelvic therapy before, and it can be extremely beneficial to even stop the need for surgery and ease the symptoms. In some cases, women aren't really given the guidance and sit down and get to share their story and find out what's going on with their body in a manner of someone that understands the muscles around the pelvis and around the body. It's going to be very helpful for you. So with any of those symptoms, like I mentioned, it may mean that your pelvic floor muscles are either they're shortened and tight or they're weak. And it's hard to know until you're really assessed by a pelvic floor therapist that can give you the right guidance. And if your doctor's told you just go do Kegels and your problem is still there, most likely you don't have a weak pelvic floor, but we need to work on the opposite and lengthening the tissue and being able to get your muscles stretched a little bit and get them to calm down so they're not tense and tight all the time. This is more common than we think, and for constipation, painful urination, or having any of the symptoms that I mentioned before, those pelvic floor muscles, that's a big red flag to us that they aren't working properly. Our goal is really to enhance your quality of life and make you feel better about it. Now, what is entailed in pelvic floor therapy? I think a lot of women are intimidated that they're going to go into a busy office and that they're going to have to undress and it's going to be embarrassing. Well, I can tell you, you want to go to a place that is small and intimate, very specialized in pelvic floor. That's what we do. We only see women, and we have a private treatment room that is very calming and comfortable, and you're not going to be around other people. Also, the therapist is going to explain what's entailed before they even start treatment. So you should understand what to expect, and also too, it's not as invasive as going to a gynecologist. It's actually only a small amount of insertion that we are able to check those pelvic floor muscles. We're not using a speculum or having anything too invasive. It's just to see what the muscles are capable of. So with a gloved index finger, we're going through the vaginal area and we're checking with breathing, with contraction, relaxation, and it's very comfortable. It should not hurt. And there are ways to assess those muscles externally too. But our standard of care is if you're going to a pelvic specialist, you should have an internal assessment. And that way they're going to make you feel comfortable about it and make sure that they get a baseline for what those muscles are capable of so they can give you the right plan of action going from there. Now, with ongoing sessions, you may see a therapist in the room and they do some of the internal work that's needed. It may include some biofeedback, which doesn't hurt. You're just given a device that'll teach you how to contract and relax the muscles and kind of trains your brain on what that feels like to let them go versus contract. We also use a variety of yoga poses, yoga stretches, breathing exercises, and as you see behind me, we have Pilates equipment, and we love to have the women that we see really understand their body better with their posture and their core muscles by taking part in our Pilates sessions and also integrating that into your care. So you should be taught things that you can do on your own, but also too, you're gonna make a lot of progress if you're seeing someone in person, and make progress a lot faster if you're in a place that's very customized and able to work with you for a longer session and not just pop in and out of the room and have an aide take over. There is no room for that here. We are very personalized and we work with our clients for up to an hour one-on-one with the doctor of physical therapy. So if you have been experiencing any of those symptoms I was talking about with pressure, heaviness in the vaginal area, anything uncomfortable in that lower abdominal region, painful urination or frequent or accidents, or even constipation or pain with intimacy, any of those issues, even with back or hip pain, it can be helpful to first check in with your medical practitioner, get screened by them, make sure there's no other red flags going on. And then from there, you have full access to find a physical therapist that specializes in pelvic floor, a place that you're gonna see a pelvic floor specialist. You don't have to be referred by your doctor. You can choose where you wanna go. But I just wanted to give you a little background on what to expect with pelvic floor therapy and if it may be right for you based on some of the symptoms that you're having. So thanks so much for watching this video. If you haven't subscribed to this channel, I talk a lot about women's health topics here, so hit subscribe so you can get notified in the future when we release new videos. Thanks so much for watching, and we hope to see you again.